East Lothian IJB Strategic Plan 2022-25. East Lothian Health and Social Care Partnership is responsible for the design, commissioning and delivery of health and social care services in East Lothian. East Lothian Integration Joint Board is the board of management for ELHSCP. It sets budgets, policy and strategy. We are responsible for adult and criminal justice social work, social care services, for example care at home, our own care homes and commissioned places in independent care homes, and community support for older people and adults with complex needs. Also hospital to home and hospital at home, mental health services, MSK physiotherapy and occupational therapy services, community treatment and care service, care when it counts, the vaccination programme in East Lothian, community pharmacy and services delivered at East Lothian Community Hospital. We are not responsible for delivering GP services or children's health and mental health services or children's services social work. We are committed to ensuring smooth transition between children's and adult services, and we supply support to GP practices through services like Quick and CTAX. Money matters. We have already made excellent progress in bringing about the integration of health and social care services. This has improved the experience for people using these services and made better use of the budgets available. Every year, East Lothian Council and NHS Lothian make a financial allocation to East Lothian IJB to deliver a range of health and social care functions. We sometimes also receive additional funding from Scottish Government for specific initiatives. This tends to be ring-fenced and time-limited. In 2020-21, we had a budget of just under 193 million. We spent 136.8 million on health, 48.9 million on social care services, 7.2 million was committed funding to be carried forward into the next year, meaning we had an operational underspend of 1.3 million. The financial challenges ahead. We need to meet the requirements for a living wage. We have to pay staff in line with national pay awards. We spent 20.7 million on prescriptions in 2020-21. That's 11% of the overall IJB budget. Responding to COVID meant significant additional expenditure for health and social care services. Scottish Government has covered some of this, but there are no guarantees for the future. Inflation is rising. Increases in energy and fuel prices will lead to significant increases in operational costs for services. East Lothian's growing population and the projected increase in the older adult population means that there will be more demand for health and social care services. Financial constraints across the public sector mean that the IJB budget is unlikely to increase in real terms in the foreseeable future. So what will this mean for people in East Lothian? Financial constraints, increased costs, growing demand and other pressures mean we cannot keep doing things the way we have previously. We need to use the resources we have differently. This might involve developing new approaches to delivering services, or in some cases, transforming services completely. We already have some good examples of how we are doing things differently and making better use of resources and improving outcomes for people using our services. For example, the work we do to prevent people going into hospital when it is not necessary and to get people home from hospital as quickly and safely as possible. This is better for patients and avoids the use of expensive hospital-based care when it is not needed. Integrating services and improving joint working between services also makes more efficient use of our resources. Challenges and opportunities. Innovative ways of working developed during COVID have been effective and have led to more permanent changes to the way we deliver services. Moving from face-to-face to telephone and online appointments has proved to be effective for some services, resulting in quicker, easier access for patients. The proposed National Care Service will change the way health and social care services are governed locally, including changes to the current IJB and HSCP arrangements. For the past 3 years, we have been working with service users and carers to develop a different approach to services for older people and adults with complex needs. For example, by supporting people to take part in groups and activities in their local community rather than in activities based in resource centres. We all know there is a shortage of health and social care staff across the country. We have difficulty in recruiting and retaining staff to deliver key services. Organisations from which we commission services experienced severe pressures during COVID. They continue to face challenges including recruiting and retaining the staff they need. We are now responsible for both the local COVID and flu vaccination programmes. This puts pressure on resources. During COVID, communities played a key role in supporting people, keeping them safe and helping them to feel less isolated. How can we build on this? National Records of Scotland population estimates for East Lothian are, in 2020, 107,901 people, in 2028, 113,403 people, which is an increase of 7.2%. However, with new housing development, the actual growth may be higher than this. There is likely to be a 10.9% increase in people of pension age for East Lothian by 2028. This is the highest increase in Scotland. This age group has the highest uptake of health and social care services. The 2020 Scottish Index of Multiple Deprivation shows that 2 areas in East Lothian fell within the most deprived 10% of areas in Scotland, and 8 were in the 20% most deprived. The impact of COVID will be with us for a long time. For example, long COVID, impact on mental health, delays in diagnosis and treatment, and longer waiting lists. So with this in mind, what matters most to you now? What matters to you most in the future? What is working well and why? What could be better and how? And what else would make a difference? What you tell us today will help us develop our new strategic plan, so thank you.